Turning now to the fight against COVID-19. If you've come down with the virus, there's a new outpatient treatment available in Central Georgia. Milledgeville explains how it works.
Yes, Atrium Health Navicent is offering outpatient COVID-19 monoclonal antibody treatments at 5 Central Georgian locations. The coronavirus attacked Erica Woodford's body in March of 2020.
It really hit me hard. Every night I just prayed that I would wake up in the morning because it was that serious that, I just couldn't breathe.
She won the fight, but 4 months later she got the virus for a second time.
I had a lot of memory issues. I had shortness of breath. I couldn't even walk up one flight of stairs, even though I'm a very active and moderately fit person.
At the time of Woodford's battles against the virus, there were limited treatment options. More than a year later, unlike Woodford, some of you have the option to get a monoclonal antibody treatment.
If that option had been available, I definitely would have taken it.
Dr. Sandy Duke with Atrium Health Navicent says it's a one-time, 1-hour-long IV treatment for COVID-19 patients with severe symptoms in the first week of infection.
For those individuals who are at high risk of having admission to the hospital and complications from COVID-19, monoclonal antibody infusions have been very effective at limiting the risk.
To get the monoclonal antibody treatment, you need a physician's referral and you must be an eligible adult or 12 years old or older. Another valuable tool in the fight against the virus.
If we can all stay mindful, stay prayerful, and stay hopeful, and stay in this fight together, I believe that we can conquer and win the battle against COVID.
The FDA gave emergency use authorization, but the hospital system says it's not a replacement for vaccination. In Macon, Milledgeville, 13 WMAZ News.
And according to Dr. Duke, the monoclonal antibodies work right away, but they are temporary, which is why you must get the treatment during the first week of symptoms. The treatment carries a warning for possible allergic reactions. Taking a closer look, Dr. Anthony Fauci says these antibodies can reduce the risk of hospitalizations or death by 70 to 85%. That said,
it is important to emphasize that this must be done early in infection and not wait, of course, until a person is sick enough to be hospitalized. That's when you get the best effect.
Another life-saving tool in the fight against COVID-19, the vaccines. If you do end up receiving monoclonal antibodies, the FDA says you can still get the COVID-19 vaccine. After the treatment, the CDC recommends waiting 90 days before getting a COVID-19 vaccine.